So my name is Michelle Stickle, and I work with the national office. And it's a pleasure to see so many faces coming into this Child Health Policy Learning Collaborative call, the first of our 23-24 season. And we have a really great topic to go through tonight. But before we get there, I do want to mention a few what I like to call housekeeping items. And so we'd like to remind everyone that the call is being recorded. You are more than welcome to share your screen or turn your camera off, whatever you prefer. We do ask that you stay muted during the presentation, but when we get to the Q&A part of the evening, you're more than welcome to come, to unmute your phone, to ask questions. I'll also be monitoring the chat box that you can insert questions in the chat as well. You may see some resources being popped into the chat as we go along this evening. I also like to remind you that NAPNAP is getting ready to host its virtual pediatric virtual symposium on Friday, October 6th, and that early bird registration ends this Friday night. So if you're thinking about coming, please make sure that you register by this Friday to save. But registration is open to October 4th. So if you can't get it done by this Friday, you still have time. Also, we're super excited because we are going to Washington, D.C. this year. We used to do our Hill Days like every other year pre-pandemic. We haven't been there since the pandemic, so we're excited to go back to DC with Dave. And we will be in DC the weekend of November 4th through 6th. So it's a two-per kind of weekend. We have two events going on. We have a pediatric seminar, which is a clinical CE opportunity. There'll be sessions Saturday afternoon, Sunday morning. These are emergencies that you see in your primary care office. Brush up on those skills. So that's called the pediatric seminar. Then later on Sunday, November 5th, and into September, Monday, November 6th, we will be doing our Capitol Hill Day. So the afternoon of the 5th is focusing on going over various issues, some of which we might talk about tonight, other priorities that NAPNAP has, just orientation to doing a Hill Day if you've not done one before. But great opportunity to gather with your colleagues to do some clinical and or some advocacy that weekend. Please go online to register. The early bird for those two events is, I think, the first part of October. So register soon to take advantage of the discount. Just as if you've never done a Capitol Hill Day with us before, I will let you know that we actually go ahead and do all the scheduling for you. So you don't have to worry about scheduling your own meetings. We have a service that does that for you. Nobody is asked to go to meetings alone. We definitely pair people up with either colleagues in your state, or if you're the only person from a particular state, then we'll pair you up with someone else from a neighboring state. So we want to make it as easy and convenient for you as possible. We prepare all the leave behind materials. So there's nothing to be timid about doing a Hill visit. We, again, try to really make it convenient and enjoyable for you. So with that, I think I've admitted a lot of people. So the waiting room is now clear. So I'm going to go ahead and introduce our two amazing speakers for this evening. After our main presentation, there may be some time for Dave Mason, our federal government affairs representative, to share some news from inside the Beltway with us. If Dave is not able to do that now, we will definitely catch up with Dave next month at our Child Health Policy Learning Collaborative. But we're going to start off with a great presentation from two amazing leaders. Kate McInnes is a senior policy advisor for youth in the Office of the Center Director of CMS, where she focuses on child and family priorities across Medicaid and CHIP. Prior to recently joining CMS, Kate was the Senior Director of Parent, Child, and Family Policy and Programs at Mass Health, where she led efforts to define a set of key questions and shape a cohesive policy strategy for children and their families. Both at CMS and Mass Health, Kate worked within Medicaid and with other child-facing agencies and organizations to understand and coordinate policy development that would best meet the needs of children and their families. She previously held both clinical and policy advocacy leadership roles in behavioral health at Boston Children's Hospital. Kate's policy perspective is informed by over a decade of clinical care, teaching, and clinical research with children, adolescents, and families with behavioral health needs in the emergency department, as well as through being a parent of two young adults. We also are joined this evening by Kelly Whitener. She was an associate professor of the practice at Georgetown University McCourt School of Public Policy Center for Children and Families, CCF for short, where she focuses on Medicaid and children's health insurance program. We all know it as CHIP. at state and federal levels. Recently, Kelly's work has included research and policy analyses to improve care for children and families in immigrant communities. Prior to joining CCF, Kelly served as the Director of State Coverage Programs at the Center for Medicare and Medicaid Services, CMS, overseeing the CHIP and Basic Health Program. Kelly also worked for the Senate Committee on Finance, managing the Medicaid CHIP and Prevention Wellness portfolio from October 2008 to April 2014. During her time with the committee, Kelly worked with the CHIP Reauthorization Act of 2009 and the Patient Protection and Affordable Care Act of 2010, and several year-end bills extending expiring safety net programs. Kelly studied psychology and Spanish at the University of Michigan and earned a Master's of Public Health from UCLA and a Juris Doctorate from Georgetown University. So we are very excited tonight to welcome Kate and Kelly. So I'll now turn it over to them.
Okay, and I think that I'm first. Thank you so much, Michelle. And I'm just going to say I'm really delighted to be here presenting with Kelly. Georgetown has been a very important partner for us at CMS as we have undertaken, before we started undertaking Unwinding, and as we have been working on Unwinding, and really have been critical to thinking about, helping us think about and identify the issues on the ground as they're happening in states, so that we get real information about what's happening for kids and their families, and we can then act on that information. And there have been multiple points at which we have been sort of developing policy. It feels like by the day sometimes, really to try to be responsive, because we want this to be going as well as it can be going. So I am going to spend some time talking about what's happening and kind of present some slides. There is a lot of material that is on medicaid.gov/unwinding. There are links in the slides, which I will send so that they can be shared. But there's a lot of material there, and relatively well organized and easy to access, which I don't always say about Medicaid.gov. So I would encourage folks, if they want more information, to go to the links that are there and sort of explore what further information is there. It's getting updated probably at least once a week with new information. So with that, I am going to share my screen. Not sure I'm sharing the right thing. Okay. So this, there we go. So this, most of this deck is available on Medicaid.gov, but we will also have it sent out. So, probably the most important thing for you all to take away tonight is that we really have been thinking about Medicaid Unwinding as an all hands on deck activity, meaning government, federal government, state government, different agencies, providers, community organizations, community health workers, families. We want to make sure that everyone is engaging with families and working with partners to help keep kids and their families covered. I'm going to keep referring to kids and families because I'm the kids and families person. We also want adults to stay covered, but this is really focused on kids and their families tonight. Spreading the word. So really, we have been pushing information out. We've had a huge push in the last couple of weeks around schools, and I'll mention that a little bit later. But today, Secretary Becerra from HHS and Secretary Cardona from Education actually did a visit together at a school in St. Louis to talk about kids' behavioral health and the importance of unwinding and making sure that kids stay covered as part of that. So that was really, everyone's joining. So we are excited that you all invited us to come and talk about your role as well. Okay, so I'm sorry for the fact that this is a busy slide. And I'm not going to read through all of it, but just to say that as of April, there are about 42 million kids who are covered by Medicaid and CHIP, which is over half of the kids in the country, more than 40% of the births in the US. Medicaid kids include income eligible kids, which you'll sometimes hear us refer to as MAGI, which is modified adjusted gross income. But also kids who are disabled, kids in foster care, and other highly vulnerable groups of kids. Medicaid enrollment overall increased by about 34% and about 5% in CHIP. CHIP acted a little bit differently during the public health emergency. So while states were required to maintain everyone on Medicaid in order to be eligible for enhanced federal dollars, they were not required to maintain the same effort around CHIP enrollment. So there were states that were disenrolling folks from CHIP throughout the pandemic. Children with special health needs and the subset of those kids with medical complexity, they depend on Medicaid and CHIP for life-sustaining treatments. We don't want them to lose their coverage. We don't want them to have interrupted coverage. We want to make sure that we're doing everything we can. And we know that you all are taking care of those kids, whether it's in a community setting or in a school setting. Kids who would otherwise be institutionalized and are therefore categorically eligible through waivers where they get their coverage because it helps them stay in the community, helps them stay with their families. Another just really highly vulnerable group of kids, and then also kids in federal foster care. So lots of groups, lots of kids, and then lots of really particularly vulnerable groups of kids that we think about. This is, Kelly knows this is sort of my new favorite slide, even though I've been using it now for a while, because I think it gives such a good picture of kind of how kids and adults are different in Medicaid and CHIP, which is on the left-hand side, you can see that is adult eligibility, which goes up to 133% of the federal poverty level. On the right-hand side, you can see eligibility for Medicaid and for CHIP, and that there is some difference among states in terms of where eligibility stops for Medicaid, where CHIP eligibility starts, et cetera. And what that means is that in a family where an income is, say, 150% of the federal poverty level, the adult will not be eligible for Medicaid. They would have to go to a subsidized marketplace plan where the kids would still be eligible. And that's an issue that has come up of late, that has been identified. And we are working with several states to kind of rectify an issue whereby kids are being found to be ineligible based on the parents, sort of based on household instead of by individual. And the states should be renewing Medicaid or CHIP coverage for the eligible children based on the available information that they have. And we're finding that in some states, it appears as though the systems are not working quite right. And so we have asked some states to stop disenrolling kids and make sure that their systems are working right before they continue. So that is something that has been, I would say, the hot topic of the last couple of weeks, and that we're very concerned about, as particularly as it relates to kids. And I'll again say that Kelly and the rest of the team at Georgetown really have been watching closely as our data has started to come in and come out and to help us think about why things look like they look. The same number of kids based on this chart that you're looking at, we shouldn't see the same percentage of kids disenrolling that we see adults disenrolling. And so that really sort of led us down this path of exploring and understanding where things were not working quite right. So just so that folks are aware, because they may have heard and or read. What I will say in the grand context, which I probably should have started with, is that we do anticipate that there are a lot of people whose eligibility has changed over the past 3 years because they have gotten jobs, they have aged out. So they went from the right-hand column they were 18 or 19, they went from being in the right-hand column to being in the left-hand column, right? From being a child to an adult, but their coverage stayed the same during the public health emergency. And so now they are an adult, and so they're not going to be necessarily eligible, say, if they're at 180% of the federal poverty level, whereas they might have been if they were still a child. So there are a lot of folks who we do anticipate would be moving from Medicaid to CHIP, or from Medicaid to the marketplace, or from CHIP to the marketplace. We just want to make sure that everybody is landing in the appropriate place for them to be covered. Just sort of that's the bigger picture that folks should be aware of. Some things that I think you all are probably pretty aware of, which is, kids are entitled to EPSDT, which means that they can have preventive, early, periodic screening, diagnostic, and treatment services. That means that they can have primary care, they can have dental care, they can have vision care, they can also have things that may not be in a state plan, but which they need to keep them healthy. 14 states have EPSDT for some or all of their separate CHIP beneficiaries, as well as their Medicaid beneficiaries. CHIPRA, which you heard a little bit about because Kelly was involved with it, so she's probably very familiar with this. Created the express lane eligibility option, which is trying to take many other systems that where the government has information about the child's the income level of the family, and use that information to determine Medicaid eligibility. Currently, only 7 states take advantage of express lane eligibility, and we have certainly been pushing on some of these systems and asking states to really consider what additional information they might be able to use to reduce the burden of individuals having to complete sort of more burdensome paperwork. School health services, which back in May, we put out a guide to hopefully allow states to increase the amount of money that's coming into schools from Medicaid, from CMS, in order to support school health services. And that pays for services in special education, as well as services outside of special education, medical services that are provided by nurses, social workers, speech pathologists, et cetera. And then one more sort of intersecting piece of policy, which is that as of January of 2024, states are going to be required to maintain kids on Medicaid and CHIP for 12 months once they're found to be eligible. Right now, that is something called a state plan option. And as of January, all states will be required to have that. So we will see that sort of kicking in the middle of the unwinding period. A couple of just additional things. Kids don't always transitions, like re-enrollment doesn't always go that well in regular times, and now there's a lot more of it happening. And so that is one of the things that we're really seeing is the impact of systems that are very heavily burdened by the volume. But we anticipate that most kids will stay eligible. Kids don't always transition smoothly between Medicaid and CHIP. I'll talk a little bit later about transition age youth, but transition age youth who are in their family's household, and then will have to become their own household, even if they're still living at home. But they also don't always transition smoothly from Medicaid or CHIP to either Medicaid. In Medicaid expansion states, they may be eligible for Medicaid or a marketplace plan. So we're sort of focused on how do we make things better. And the other thing that I've been trying to remind folks is that one of the things that's really important in terms of reminding parents that even if they themselves aren't eligible to fill out the application, they may then not have to pay for a family plan in the marketplace because they are going into the marketplace, but their kids are staying in Medicaid or CHIP. So some populations that I am particularly worried about and we're particularly worried about, parents have enrolled kids under the age of 3. They have never had to do a Medicaid renewal for this child. So that's, you know, they've been told you can just ignore that packet that comes to your house if it comes to your house. And so that's one population. They, as you all know, they come in for a lot of visits before they're 3. And so that's a group that we worry about a lot. Immigrant families, because of all of the reasons, including you know, linguistic issues, access issues, mixed status families. They may really need support through community brokers. They may need support through interpreter services or translation services that you all have in the settings that you work in. So that's another group that we just worry about, those kids. And then kids with disabilities, some kids get SSI, and a lot of kids who are pretty medically complex don't get SSI. So they may not be categorically renewed. And again, just worrying about making sure that they have what they need. So a couple of things that I will just point out here. This is just a little more detail about what I was just speaking about. One is the linked toolkit here that my friends at Georgetown and the AAP put together, which has state-specific toolkits. So every state has, whether you are in Tennessee and it's TennCare, or Massachusetts and it's Mass Health, or California and it's Medi-Cal, the logos and the names of the programs are on those materials, and they're incredibly thorough and helpful. So those are things that you can go and access. And I would encourage you to do so. A lot of families, and I know this from my many years of clinical work, if I had said to people that they had Medicaid, they might have looked at me with 2 heads. If I said that they had Mass Health, they knew exactly what I was talking about. So we've been trying to sort of encourage as much as possible, having the language that people will recognize on the materials. And then transition age youth. I spent a bunch of time talking to some young adults and really thinking about with them what is the most helpful thing. And, you know, they said the folks who they already know, so the transition age youth serving agencies and community partners are great folks to connect with. Those of you who are adolescent providers probably interact with a lot of these young folks. They don't necessarily come in with their parents. And so thinking about how to engage, and we have had great input from young folks, and have some materials specific to them that are available that you can actually order. And here's, I think, where you know, kids and families, they have their people, and a lot of times their people are their nurses, their doctors, their social workers. It may be their schools, it may be, right, but they often need really hands-on help. They don't only need the postcard with the phone number on it. They really need hands-on help. So knowing where either, you know, there are offices that have folks embedded in the offices, or schools that are doing hands-on support with enrollment, but thinking about where there are last mile helpers to get folks the right support to get the renewals done. Kids depend on their peers. And so when there's available trained peers, and this, I think, in several settings, and I think in the mental health world has used peers a lot for quite a while, and are using peers to get the word out related to this as well. There's a lot of information for community partners. The Connecting Kids to Coverage campaign, which has grantees in a lot of states, and has a particular set of grantees that's focused on American Indian, Alaska Native communities. They are usually about, their work is usually pretty singularly about enrolling unenrolled kids. And this year it is also sort of including making sure that those who are enrolled stay enrolled, or who need to move from one program to another program are getting the support to do so. So if you click on the links in the deck, you can find out who the outreach partners are in your area. You know, I have been saying, I say about adult learners, you need to hear things, you know, a dozen times, but I think for this, as many times as families can be hearing about the messages, if they're hearing about it at school, and they're hearing about it in your office, and they're hearing about it in the community or at the Boys and Girls Club, they got something that came home from camp, which is somewhere that we push stuff out this summer. That's okay, because one of the things that's happening in Unwinding is that the month that a portion of every state's enrollees are assigned to a given month. And so if you talk to somebody in September, their month might not be until February. So I hope that people are continuing to talk about this in September and October and November and December, et cetera. Because if you talk to them in September when their kids were going back to school, they're surely not going to remember that by the time February rolls around. So this is some of the information. I referred to the webpage. You can go and click through, and you can see the policy information that we have been pushing out, as well as slide decks materials, communications materials, etc. These are a couple of the postcards that are available, and this is the you can see the bottom one here is fillable, because we want folks again to recognize, and this was one of the things that kids said when we talked to them is knowing that half the kids in the country are covered makes them feel much more like the kids around them are also going through this and needing to learn about it, and it's not something to be embarrassed about or anything else. And so that was actually a really important message that they suggested, was the sort of about half the kids. And this is a lot of resources. And I think I'm going to hand things over to Kelly, and I think Kelly's going to talk to you about sort of what you can do in your own states. And I don't know if you all do this, but if folks either feel comfortable switching, I meant to ask this at the beginning, changing their names and putting their states so that we have a sense of where folks are from, or if you put in questions into the chat, that might be helpful information for us to have as well. And should have said also, please feel free to drop questions in the chat. We also will make sure that there's time for conversation, and we encourage folks to ask questions. It's a lot of information. So Kelly, it's all yours.
Thank you, Kate, and thank you all for having me. It's really nice to be here. You've heard about CCF and you've heard about who I am, so I'm going to skip all of that stuff and just say that I think we're all here with a shared goal of wanting all people, but especially children, for tonight's conversation, to have access to high quality, affordable medical care. And a lot of the things we're talking about now are just kind of the current barriers to making that dream a reality, but that's what we're working towards. And related to that, I just want to say thank you for all the work that you did before the pandemic, during COVID, still in COVID, because it just is so important. Really appreciate the work that you do, providing care to people in communities, participating in Medicaid, hooray. And just, I know from most of you, I think on the line are nurse practitioners. I know from personal experience how wonderful the work is that you do. So just thank you so much for that. And then without further ado, I will jump in and share some kind of points here about what's going on. Sorry, I can't really multitask. So as I pull up my screen, I can't still talk. Okay. So hopefully you can see these slides now. I'm going to zoom out a little bit from Kate's presentation and provide just kind of a little more context about why we're all kind of a little bit freaking out about the unwinding and what's going on right now. So this chart shows the national rate of uninsured children over time. You can see that we were doing pretty good. We had some key inflection points. CHIPRA authorization in 2009 was one. The ACA or Obamacare going online and new coverage options in 2014 is another really important one. And then things started to go in the wrong direction, unfortunately, in 2016. That coincides with the Trump administration, where just a lot of things were happening. There was a huge debate, I'm sure you remember, about repeal and replace of the Affordable Care Act. There were also increases in red tape and barriers to coverage, like work reporting requirements and other red tape barriers. There was a whole public charge debate. So there was just a lot that made it a lot harder for people to access Medicaid and CHIP coverage, especially, but really health insurance generally was out, so to speak. And I want to point that out because unfortunately, I think this is kind of foreshadowing of what could happen, and it could actually be worse this time around. So, it doesn't take much to see, instead of that downward trend where more and more kids are getting coverage, it doesn't take much to turn it the other direction and actually see kids losing coverage. And this is also kind of pre-pandemic. We had a little bit of a problem with what we call the eligible but unenrolled, or EBU kids. So if you look just at uninsured children, this is from the Urban Institute, and I love showing their pie chart. It shows you among uninsured children how many were eligible but unenrolled for Medicaid or CHIP, and that's that big piece of the pie. So even before Medicaid unwinding, before COVID, we had a problem where kids were eligible but not actually gaining coverage. And of course, that's important because while children are generally inexpensive to cover, you all know that they are very regular users of care. So any kind of gap in coverage can mean a gap in care. So then along comes COVID and the related COVID response bills on the Hill that led to this continuous coverage requirement, which is now being undone, and thus the unwinding. And what that continuous coverage requirement did is generate these major increases in Medicaid enrollment. So generally, overall, there's about a 30% increase in Medicaid enrollment. For adults, it was over 40%. For kids, it was closer to about 20%. And as of April 2023, before states started doing the disenrollment, Medicaid covered over 94 million people. So this is a huge program covering a lot of people. Kate walked through how some of the people covered are particularly vulnerable with special healthcare needs or other circumstances in their life that make Medicaid really important. And now states are tasked with the responsibility of going through each of those cases and conducting a fresh renewal. So it really is a huge amount of work that's facing states. And unfortunately, it's not going as well as we all wanted. So now just kind of pivot for a second to talk about child vaccination rates. This is also pre-pandemic. We had a little bit of a problem here. So even before the COVID vaccine came about and vaccines became even more politicized, we had increasing vaccine hesitancy, you know this, increasing vaccine avoidance. This led to decreases in herd immunity, increases in outbreaks. And these data are from the American Academy of Pediatrics. They have this very cool interactive map and website dashboard where you can see kind of the breakdowns. So I'm also showing us a little glimpse. This is just for the MMR vaccine of how it varies by insurance status. So even though, pre-pandemic, Medicaid had some work to do to get more kids who enrolled in Medicaid with that MMR vaccine, you certainly see that Medicaid is doing better than being uninsured. So the more kids we have in that uninsured group, the greater potential there is for problems with access to vaccine, and we could see more and more outbreaks, unfortunately. So all to say that it really wasn't great before, but in hindsight, it was pretty good because now it's looking so much worse, unfortunately. We really see kind of a perfect storm. With the Medicaid unwinding, we've already seen more than 5.7 million people lose Medicaid. That is definitely an underestimate because we don't have all states reporting. And then of those, overall, 73% of disenrollments have been due to procedural reasons. So what that means is that the Medicaid agency wasn't able to determine if the family or the person was eligible. The clock ran out and they were automatically disenrolled. So a large share of those procedural disenrollments, we believe, are people who are eligible, but for some reason just didn't get through that whole process in time. And then another kind of unfortunate circumstance is that children account for at least 4 in 10 of those disenrollments. This is also a big underestimate because unfortunately we don't have data from states broken out by age on how the renewals are going for kids. So this is just from 15 states. You can imagine that it may be actually much worse. And so while all this is happening, we know people are losing Medicaid coverage. We know that many of them are actually still eligible for Medicaid. So they're not necessarily, making that jump to marketplace coverage or to private insurance coverage. They're more likely ending up in that uninsured column. We also have the vaccine politics just getting worse and worse and worse. So it's just more polarizing than ever before, with increased resistance to even routine wellness vaccines, let alone the COVID vaccine. So what are we going to do about it? This is where I'll try to be a little bit more optimistic. I think there's a real opportunity here. You can monitor the unwinding in your state. There's a couple ways I would suggest that you do that. The first is to review publicly available data. On our website, on Kaiser Family Foundation, I have some of these resources at the end of the slide deck. We can also share them around after the call. You'll be able to see, what is your state reporting? And it might be that the first sort of ask you have of your state policymakers is to be more transparent. There are some states that still aren't reporting data, or they are reporting data, but maybe not at a granular level to where you can see what's really going on in your local area. And as I said, most states are not reporting data by age. So we're not really able to see a particular picture for what's happening with kids. You can also, if your state is reporting some data, you can see how your state compares to a national median or to neighboring states. I find that that can be a really helpful kind of advocacy point. If you can say, listen, we're really falling behind. Most states are doing better than us. Or if you can say, oh, we're falling behind, our neighbor is doing better than us. Some of that kind of healthy competition might help turn things around. The other point I would say, particularly as people seeing families on a regular basis, gather those stories. Make sure that you are partnering with community leaders and other healthcare providers, pharmacists, other health policy experts, so that you're able to kind of gather that intel and compare notes about what's going on. And as part of that, I would say really trust your instincts. So if you're kind of reading certain things in your local newspapers, you're seeing things on the data dashboards that your state may be posting, but in your practice, it's not matching up to what you expected. It's not lining up. Trust your instincts and say something. Ask questions, talk to the media, don't be afraid to raise it. I always like to start with asking questions if you're not sure, if something is really wrong, or maybe there's just kind of a misunderstanding in how the data is presented or something like that. So asking questions can be an easy way in to understanding what might be happening. And then on vaccines, because this is just coming together where it really could be that kind of double whammy, kids losing coverage, increased hesitancy around vaccines, I would say the main thing to try to do is to really reframe that vaccine conversation. And the Frameworks Institute put out this really excellent report. I have a link to it here. It goes through how vaccines are talked about, how important that is, because they really shape public support for vaccines, and has 5 evidence-based recommendations for communicating about vaccines. I watched them do a presentation on this report, and actually it would be a great future conversation for you all to invite them to do that presentation. It's just really useful information about how to talk about it in a way that might bring some of those people in the middle along. I would also say, like on the Unwinding, where you want to be partnering with others, it's important to join any state or local immunization coalitions, and be prepared to testify at legislative hearings, write to your local newspaper. You may also want to prepare some of your patients to testify or to write. but I'll put kind of an asterisk there and just say that it does take a lot of preparation, training, because there's such vitriol in the public discourse right now around vaccines. You wouldn't want to send a family out, into the fray without some of that training. So, make sure to be prepared. But I think that with these two sort of things colliding, there is a real potential. It could be that because of some of the problems Kate discussed about how things are going with Medicaid systems and maybe kids losing coverage inappropriately, it could be that this unwinding helps expose a longstanding problem and gives a real opportunity to fix it. And maybe we can see that eligible but unenrolled share of the pie shrink in future years. There is also real success around pushing back on harmful vaccine-related legislation at the state level. It just takes a lot of work. So don't feel like it's just impossible. I would say go ahead and jump in, be engaged, and partner up with people in your community. Your voice is really important and has the potential to really change directions. And here's my final slide with some resources. I mentioned our unwinding data. We have a bunch of stuff. I could do a little walkthrough of that if that would be useful. The Kaiser Family Foundation also reports a lot of really great unwinding information. I'll say CMS does report good info, and Kate is right that it's better organized than a lot of other parts of Medicaid.gov, but there is a little bit of a lag on the CMS side, so you might see things a little faster from Kaiser or from CCF. And then Kate also mentioned some of these consumer-facing flyers. These are really helpful. They are tailored to your state. They already use your state Medicaid and CHIP program name. They use the income eligibility cutoffs applicable to your state and by population. And they are available at those links and customizable. So if you need to make little tweaks, you can post that in your office or just have that information handy. The first one is a 3-step renewal flyer that's really saying like, hey, this is happening. Be sure to return your renewal packet. Even if you don't think you're eligible, your kids might be. Even if you miss the deadline, return that renewal packet. And the second link there is for a coverage loss flyer, because obviously we can see that people are losing coverage who probably shouldn't be. So that message is a little simpler. It's like, hey, if you recently lost coverage, apply again, come back, may have been a mistake. So let me pause there and I will stop sharing and we can open it up for questions.
Thank you so much, Kate and Kelly. Great information. I did put a few of the links that I could quickly grab into the chat for folks. I encourage Kate and Kelly to feel free to add more links from your presentations to the chat. We can also, if you share your slides, we can attach them to this video, not attach, but you share them together on our website for on-demand access later. So questions for Kelly or Kate, anyone, feel free to come off of mute to ask your question, or you can put your question in the chat window, whatever is easiest for you.
Hi, everyone. It's Raji. May I ask a question?
Thank you, Raji.
Hi, thanks, Michelle. Hi, Kate and Kelly. My name's Raji. I'm a nurse practitioner in California and a past president of NABNAP. So thank you so much for being here and for your presentation. I had a comment, and maybe if you can help me clarify one thing, and then a question regarding re-enrollment. As I understand, during the pandemic, there had been a change in the child tax credit that was provided as part of the American Rescue Plan Act. I think it was $3,000 for older children and maybe a little bit less for younger children. And if I understood correctly, that amount essentially lifted millions of children at or above the federal poverty level at that time, which I thought was really interesting and really kind of cut the number of children that were in poverty. And so that I understand is now gone, but I thought that was an interesting data point in terms of just the number of children that were in poverty and maybe not always knowing in the end how much that might have impacted food insecurity or just the stress that families and children were experiencing, during the pandemic. So I learned about that data today, and I don't know if I'm saying that correctly, but I wanted to confirm if I understood that correctly.
I will put a link into the chat. We partner a lot on tax issues with the Center on Budget and Policy Priorities. They have great tax experts there. And you are right, the increase in the child tax credit had a tremendous impact on reducing the number of children in child poverty. And it's too bad that it wasn't extended. But there's a link to a report that shows some of the effects of that increase. It was really pretty incredible.
Great, thank you. And then one of my questions was, I think this is a strategy in California as states are starting to look at their Medicaid enrollment plans to try and potentially, if they're not eligible anymore, to try and almost create an auto enrollment process by which they could be auto enrolled in one of the state marketplace plans, so there wouldn't be any gap in coverage. I'm wondering if that isn't a strategy that a lot of states may be looking into for children or for their families.
So there are some states that before the pandemic had a single system where the information goes in and it sort of puts you into the appropriate system so that your information should be getting sent. And this should be true in states that information is being sent. If you are not found eligible for Medicaid, your information is being sent to the marketplace so that you're not doing an application and then doing an application, right? So that there are just fewer gaps for people to fall into. I believe, although Kelly will correct me, that people still need to be engaged in their plan choices, right? So there is a point at which people need to be engaged in the process. The other thing that neither one of us really emphasized as much as maybe we should have, which is there are actually there are procedural terminations that are happening that shouldn't happen. There are also ex parte renewals that are happening, and that's part of the data that you can see on Medicaid.gov, where, you know, based on other systems information, there's enough information to find the family and the child eligible, the family or the child, hopefully, eligible, and therefore people don't actually, they get something in the mail that doesn't say please return it. It says you've been found eligible and you're all set. So not everybody is having to either go online or go into an eligible enrollment center or fill out a paper packet. But one of the things that hopefully, as folks who are seeing kids and families every day, if you can remind folks that they can still go in and update their addresses on the portals, or if there's someone in your front desk, those sorts of folks who can do that, that would be really helpful, because one of the things that we know about families living in poverty is that they tend to change addresses more than average. And so they might have changed their address in February in the system, but next January, it might need to be changed again, because next March might be their time to be for their redetermination. So that's a message that it shouldn't get old. And because that information and you know, we have pushed states to take advantage of every opportunity, flexibility, et cetera, to get information, including asking health plans. So because such a large percentage of kids in Medicaid and CHIP are in managed care, asking the health plans also to be doing that kind of outreach to making sure that we have correct information.
Thank you.
Other questions?
Other questions from the group? Raji, I think we covered yours. We're good. Okay, good. Other questions from folks? Again, you can come off of mute or put something in chat. And while people are thinking of questions, I'll ask one. Kelly, you covered some immunization specific information. Thank you so much. I guess you here at NAPNAP, we're deeply concerned by the low COVID-19 immunization rates. People have told our members who tell us that once the public health emergency was retired or sunset, that people believe that COVID was gone, even though news reports show that COVID is increasing and hospitalizations are increasing. So what can we do? And we know that the CDC has very little funding, if any funding, left to promote COVID immunization. So what can we do as nurse practitioners to advocate somewhere specifically for COVID because it hasn't quite caught on enough yet. So your thoughts, or Kate, your thoughts.
I could start, and I'll just say that, I think it's a great question because unfortunately, a lot of people now, because of all the attention around potentially scaling back routine childhood immunization and, changing school enrollment requirements and things like that, people have had to, child health advocates who really do want everyone to have the COVID vaccine too, they've had to kind of back off their COVID vaccine advocacy to focus on those very routine, basic immunizations because there's just so much heat in that space too. So first, I'm just encouraged to hear you raise the question that you do still want to do advocacy around a COVID vaccine. It's not for the faint of heart, and there's certainly a lot of other areas that need your attention too. As far as kind of how to go about it, and like what support might be available from the CDC, I don't really know. I know that it's working its way through the process to be on the Vaccines for Children program. So that should be happening. But there are still challenges. Once the current batch of COVID vaccines that were paid for by the federal government are no longer on the market, there is still a challenge for providers to have enough of that private vaccine stock available to match their VFC stock. So there are some logistical challenges there that I think are going to make it hard for it to be available in your offices. And I think that's where families want to get it. I think, for myself, when I got my own vaccine, I went to the Rite Aid. I was totally fine with the Rite Aid. That worked out great for me. When my 6-month-old, when it was time for her to get her COVID vaccine, you bet I wanted to go into my regular routine provider. And not a pharmacy line. So I think it's really important for kids, especially young kids, to be able to get it in your office. And unfortunately, there's still just a lot of kind of logistical barriers to making that happen. But I think it's in the works. And maybe Kate can say more about some of those policy changes and things that are happening.
Yeah. It's really hard, like just acknowledging that it's been really hard. It was really hard when we were in the thick of it. And, I'm from Massachusetts. We poured money and effort and we had people on the ground. We partnered with our Department of Public Health, with our local departments of public health, et cetera. And nothing really moved the needle. And there was definitely, or moved the needle enough, I will say. And there was definitely really a huge difference in the sort of socioeconomic and demographic characteristics of kind of who was taking their kids to get COVID vaccine and who wasn't, right? So, and that was inversely proportionate to the communities where you would want to, where there was more COVID. So it was really hard to get at that. We now, we're also this season going to be having RSV vaccine. I use the term vaccine loosely because it's not actually a vaccine, but we're the monoclonal RSV treatments that's going to go through Vaccines for Children. That's there's going to be messaging about that, and that's in newborns and in pregnant women. So there's a huge amount that's happening in sort of the vaccine space, and it's hard to know how all of those things, I sort of would defer to you, the providers, if there's the range of, if there are a set of conversations that you need to have, you may need, just like with everything else, to think about, the prioritizing of the messaging and, it's a challenging space. And I think we have a group that is the CDC, CMCS. I don't know everybody who's on it yet. AAP, there's a bunch of folks. I sometimes show my newness at CMCS. but there's a large group who are really engaged around all of the different vaccines and about vaccine hesitance and how to decrease vaccine hesitance. So there will be more news to come on this, but I appreciate the question.
Thank you. Thank you so very much. Amanda Lee, I see your hand raised. I see another one, but we'll start with Amanda Lee. Go ahead.
Yeah, thank you so much for this really comprehensive information. I appreciate it so much. And thinking for those of us on the call, many of us wear a couple different hats. So we're providing direct care to patients and working with families, and then also thinking from an broader advocacy perspective. So just for some of the takeaways for us, I imagine one, it would be helpful for us to even check in with our own organizations to make sure that we know how they're managing redetermination. I'm sort of like tangentially involved in my organizations, and there's a whole massive team working on this like every day in the community health setting. But I'd be curious, I think from the advocacy piece, I really liked your suggestion to make sure that there's visibility from the data perspective, but I was wondering if you could share any resources. I know like Kaiser Family Foundation has a lot of unwinding data, but if there's any other resources that we can use that give good insight into the state level data, or if that's really kind of a state by state thing we should dig around for our own states.
So a lot of the states have their own dashboards. Kelly, I don't know if you want to take this one also, but a lot of states have their own dashboards. Kelly talked about the delay that we have getting data, because we need to get the data, make sure it's clean and comparable across all of the states, which it isn't always perfect when it comes into CN. So there's a huge process of making sure that what goes on to that when you look at Medicaid.gov, it's apples to apples, or that there's very clear asterisk, this state didn't get this thing in on time, so it's not there, right? And so that's why there's a delay, but a lot of states have their own dashboards, and I would encourage you to go and take a look at them, and some of them have more. The stuff that's on our dashboard is the stuff that was required by the Consolidated Appropriations Act by Congress. And so, you know, one of the things that was not required was to separate kids from adults, except that there is a requirement that CHIP data get reported. So yeah, and then Kaiser does have data. It's not as apples to apples across states, but it does give a lot of data. So
I will put our unwinding renewal data tracker into the chat too. It has state by state. We're taking the CMS data and just making it a little more visual, so you can kind of see how your state is doing. Kaiser Family Foundation is taking CMS data and data dashboard data and putting it together. So as Kate said, it's not as apples to apples, but it is more information. So I would really encourage you to look at all of the sources, especially as you say you're wearing multiple hats, like, you know, check it all out, and then it's going to raise questions for you, and bring those questions to the people that are doing this all the time.
Mary's had her hand raised, waiting patiently.
Yes, I'm sorry. Thank you. I was putting information in the chat there. So Mary Beth Petracco, Council.
Yes, I
Petracco.
saw it. No worries. I just want to let you know that New York State Health Department and their vaccine program just today had an update for all providers in New York on transitioning from the free vaccine to the COVID vaccine to the fee vaccine. It was excellent, and they have a plan in place for us who use a lot of VFC vaccine. They do have a little bit. They said as soon as they get it, we might not get as much as we want, but that they are going to like distribute it for us. And you know, a lot will depend on how many doses that you've given in the past. But they have assured us that there will be enough vaccine, and New York State will make certain that there's enough vaccine for our CHIP children and our all of our VFC children as well. So like I said, I was really impressed today. the state health department did a sensational job. And I'm really lucky that I come from New York because we have a really vigorous CHIP program for our children. And the state provides vaccines. There's no child in New York State who can't get a vaccine who can't pay for it. It's just there for them. So, and we have got a dashboard, and I probably can dig it up to find out how many children we're losing, because New York is already trying to make sure that we don't lose all of those children. So part of what I do here in New York is, I make sure that I keep in touch with the state health department and also with my legislators to let them know that this is an issue for children that I'm taking care of. I take care of mostly lower socioeconomic children, but I know when it's time to start those vaccines, I'm going to have New York is going to be right there for us and have everything available for us. It just the reason I wanted to share that was because I think New York has really put forth a really good paradigm to do what they can to help us to make sure that the children get what they need. They're also addressing the misinformation issues and giving us some of the tools. They do use a lot of CDC materials, their RISE program and some of the other things that CDC is putting out. So those kinds of tools are really helpful to us providers. So thank you very much for this tonight. It was sensational.
Thank you, Mary Beth. And thank you to all of you this evening who have joined us from all across the country. I feel like we have all parts of the country represented. I did try to put everybody's location if they hadn't been able to, so that our presenters could see the wide range of folks. We have had a few people drop off. Any other questions out there from the group? I would like to remind folks that our next Child Health Policy Learning Collaborative will be on Wednesday, October 4th, and we'll be talking about RSV policy. So Kate mentioned RSV, our monoclonal antibody. NAPNAP has been very much in support of that product and coming to market. So we're super excited to talk more about that on October 4th. If you have any questions about tonight's call, please email to healthpolicy@napnap.org, and we can reach out to Kate and Kelly. Dave works with them regularly and ask questions. We will get their presentations, hopefully, and be able to upload those along with the video from tonight. You can share with your colleagues to come and check it out, because there was incredible information here that is really important to all of our members working, especially those in primary care. So last call questions.